accounts for 38% of the population, but 50% of the new HIV cases in the United States every year. This geographic overburdening to play out all over, but we are seeing it in certain communities far more so than we have seen in others.
Did the Affordable Cares Act that was passed in the early 2010s, did it do anything to help that disparity, or has the number stayed about the same?
Well, there are certain disparities that clearly it impacted. More individuals, for example, had health insurance than they did prior. But some of the disparities that we're discussing in our report really are not just limited to people who have insurance or don't have insurance. It is also about how COVID has impacted certain disease states to exacerbate or to brighten the concern that we're now describing. I often am struck, having worked in various parts of the country over the years, that if you are, for example, too sick to work, you end up having a low income. If you have a low income, you tend to not have health insurance. And that means that you often cannot get prevention services. You are also limited by access. So programs like the Affordable Care Act and the availability of insurance have helped that. But you also have the problems of, if you want to prevent problems, do you have a provider anywhere near you, even if you have insurance?
Certainly.
In many of our rural communities, that has been a huge problem, and substance abuse has been a very glaring example of that. Or being able to get access to a mental health provider. Those are the types of things that it's not just about insurance, it's also how our systems are designed, how they're incentivized, and the geography of where you happen to live and what you happen to look like.
A lot of people will say health disparities know no color or gender, but that, as we know, that's just not the case when it comes to low income versus high income. What impact do these health disparities have on our society as a whole? Well,
they clearly are impacted by gender, by race, by region of the country, as I indicated. What we're also seeing is that they tend to have an impact on us as a society and economically. We spend billions of dollars on things that are a reflection of disparities. People not being able to get to access sooner or not being able to get access to prevention. Those types of things are happening to everyone in the country. And what COVID has done is to show that this isn't just about poor people. If you need to get seen in the hospital right now in many communities, even if you have insurance, there's no one there to see you. There are not enough beds. Inequity is not solely economic, but economics clearly play a huge portion to that. And as I pointed out, in some cases, it's not just that you want to be seen, but there's no one there to see you. The closure of hospitals and clinics around the country, particularly in rural America, are continuing to exacerbate this particular problem. But overall, I think that it's important to realize that we've been talking about disparities for decades. Hopefully we can begin to start to put together some findings and some suggestions and recommendations of what we can do over the next 20 to 30 years to really have this positive impact on our society.
We're in agreement there is a disparity when it comes to health care. But who is impacted the most? Is it low income, no matter of gender or race, or is it low income where race and gender are involved? Who actually are the groups that are most impacted? I think low income probably has a lot to do with it.
Well, low income clearly has a lot to do with it. But if you are in a rural community and you have resources, but it takes you 3 hours to get to your provider, you are being impacted if that resource is not local to you. If you are the person who has a job with no leave, for example, you are being impacted. Even though you may not be in low income, you don't have the ability to leave work, or you don't have paid time off or sick leave. Those are things that we have known for decades that impact this problem. We're just seeing it on a far greater scale. And yes, it is a definite reality around race and gender and age. If you happen to be older and have more healthcare problems and aren't able to have a ongoing income, you will be more impacted than someone else. But that is not the principal problem. This is impacting all of us, either directly or indirectly, economically, clearly, but also as resources are reappointed because of this. We're seeing people in lots of places who are struggling with this type of inequity.
Got about 90 seconds left, Doctor. What actions do you suggest or is recommended by this report that we take to try to, reconcile some of these disparities?
Well, the big one is that we need to restructure our system to incentivize prevention as for both physical and mental health, not just for people once they get sick, but trying to keep them from getting sick or getting more advanced disease. We need to adapt longer-term investment strategies in communities, looking at investments in healthcare in individual communities over a period of time that allows them to have the resources that they need. And to make improvements in how we collaborate. Individuals can make a difference, but the impact of doing this is going to be driven in large part by the behavior of our healthcare systems and how they are able to better or effectively communicate with populations. And then the last part of this that I think is particularly important is that we also need to make sure that as our interventions are being developed, whether or not that is systems or products, we need to make sure that the people that we're doing the work for are the people who are represented in the research in our studies, so that we can make sure that we are giving people clarity as to are there differences in what's happening and that they are being effectively represented. It's hard to communicate with people about a problem when it doesn't reflect who they are.
Dr. Rawlings, thanks so much for taking time out with us to talk about this very important subject. Have a great holiday.
Thank you very much. And I'd encourage people, if you can, to go to VIIV healthcare.com/health equity to see the entirety of the report.
Thank you,
have
sir.
Have a wonderful holiday.
You as well.